Good morning, everyone, and thank you for joining us. My name is Jennifer Larson, and I'm the training coordinator for the Office of Community Living. We'll just go through a couple of quick housekeeping items. We are recording today's session for posting later on our website. We will be using the Q&A panel to manage questions, so please click the Q&A button at the bottom of your screen to type those in as you have them. The chat will only be used to share links with you. We will not be responding to questions there. A copy of today's slides are going to be available on our website. We'll add a link to those in the chat for you, so you can click on that and open them. And Zoom does provide closed captioning. If you click on the CC button at the bottom of your screen, you can turn that either on or off. And with that, I will go ahead and turn it over to Bonnie to start the presentation.
Thank you, Jen, and good morning, everyone. I thank you so much for joining us. This is our biannual, so twice a year, Office of Community Living webinar. We have these webinars, I think now twice a year, really just to give an update, an overarching update on the work of the Office of Community Living. So if we can go to the next slide, and I will sort of give you an overview of what we have planned for you today. As we are entering, it's government. So our new year starts July 1st, not January 1st. So as we enter the new year, we are looking at what are our goals for this next year. So I'm going to give you a little preview on where we will be focusing in this next year. And it probably feels like forever ago, but the legislative session just wrapped up. And so we will be giving a brief recap of the legislative session, really as it pertains to the work of our office. We will also give an update on our efforts to really stabilize long-term services and supports related to the converging, impacts of really systems issues that have impacted this community. So specifically the PHE unwind, the care and case management system launch, and the transition of case management agencies, and how those three things have impacted, member eligibility, and by proxy, providers' ability to bill. And over the last few months, we've implemented several strategies to mitigate those impacts, and we continue that work in a very steadfast way. So we'll provide a brief update here, although we have a web page and have been providing ongoing communications around that. It wouldn't be an Office of Community Living webinar without a case management redesign update. As many of you are very aware, we have been redesigning what it looks like to receive case management here in Colorado. Under that umbrella is comprised several different initiatives. So the team is ready to provide some key updates today. And then because the system certainly was, we were bored waiting for some new things to happen from the federal government. Our federal partners have published what I would lovingly refer to as probably the most significant and transformational and impactful regulatory reform rules that I've seen really in my career, as Biden is ending his first term as president. And so these are referred to as the access rules. I will just maybe say that it's really easy to sort of get lost in the operations of these regulations and if they're possible, and the provider impact, the state agency impact. I would like maybe for you all to start with the hope and promise of these regulations, and then certainly lament about if we're ever going to be able to do them. But there's a lot of hope and promise in these regulations. So I want us not to lose sight of our desire and ability to look at how we can always be doing better. And then we have some key American Rescue Plan Act updates. Here also, I can't believe at the juncture of sort of rounding the curve on that transformational bucket of work. So some final grant opportunities we want to make sure that you are aware of. and then some opportunities to engage around our work. So a fairly full agenda for just an hour. So with that, I'm going to push us forward. I also want to give you all just a heads up that I'm going to give a high level overview of our 2024, 2025 goals, and then pass it over to Colin Laughlin, the Deputy Director of the Office of Community Living. And then I am going to have to jump off the webinar for another commitment and engagement. I will stay on until just before 10 a.m. And then have to hop. So if you have any questions for me specifically, I will, we'll sort of take note of anything that you have and make sure that we do our best at the end to answer any questions that you might have. So with that, if we can go to the next slide. I think that what you will see on this slide is goals that look very familiar to what I have presented over the last 2 years. I have made the commitment to you all, certainly internally to my staff, that our job really is implementation. The Office of Community Living was created in 2014 via an executive order. The goals of our office really were set forth when a group of stakeholders, which included members, advocates, family members, provider organizations, case management agencies, other state agency providers, created the Community Living Advisory Committee, and they set forth a series of recommendations for how to transform long-term care. And subsequent legislation flowed, and man, we had our marching orders. So we have, really spent the last 5 years in particular focused on how do we implement all that has been put before us. And so this is sort of the next generation of implementation. I will also be really honest, we are the kings and queens of, rolling up really what is like 5 or 6 goals into one big goal. And so I think up first is our ARPA project closeout goal. Within the American Rescue Plan Act, Colorado has, we're down to 61 projects, really aimed at leveraging this once in a career opportunity. As we are closing out this project, our goal remains to be that these are all on track, that we leverage this federal funding to really make sure that the problems that we had at the beginning of ARPA, that we have insight on how to better solve them or to solve them at the end of ARPA, that we really use that money to better our communities, to support our providers and the people that we serve. So that is, I think, up first. Next, we have increased access to community-based care. So when we look at long-term services and supports, a key, I think, value for us is to make sure we have a strong continuum of care for people that meets their needs and their preferences, and making sure that options for people to receive care in their homes and their communities is at the forefront of that. And so we are looking to increase member education proactively on their options for community-based care. And part of that is making sure we have processes in place to expedite financial eligibility. So we have spent the last few years, receiving the budget and legislative authorities necessary to implement presumptive eligibility in our state, which I think is a really big win, which will allow us to more readily enroll people who we know are eligible. But, that enrollment process for long-term care is so long. And for people who desperately need services, it can be really difficult. So we're really excited to move some of these key goals forward to better serve people who clearly need the services the most. Next up is addressing those critical staffing shortages. The direct care workforce crisis is a national issue. It's not a Colorado issue, but I will say I, for one, am really proud of the work that we are doing here in Colorado to address it. Folks have taken notice. We have been appointed to a national panel. I think it'll be talked about a little bit later on in the webinar to talk about our strategies around increasing the direct care workforce. And it's really about not just stabilizing that workforce, but growing it for the longer term. It's, how do we increase that workforce not just now, but 5 years from now, 10 years from now, and what are the longer term strategies that we need to have in place to better assure that. And so the team has a whole host of efforts in place to move that forward. It truly is transformational, some great work happening there. Next up, we have increased person-centered case management services. You see that we're changing the language here from that whole case management redesign umbrella, as we have implemented many of those efforts to really, we are down to implementing our new assessment and our person-centered budget algorithm. Everything else we have accomplished. Thank you very much, community partners. And, you know, with some of the challenges with the implementation of our new care and case management system, we are reconfiguring sort of what our path forward to that is. But we are looking at how we can go ahead and implement, as you know, there's a lot of things I think that intersect with this new assessment and person-centered budget algorithm. More on that to come. I think we're sort of still in process around sort of what's next there. And then last but certainly not least, I'll sort of end with that, you know, commitment to having a strong continuum of care, is that nursing home industry transformation, you know, making sure that, you know, when we're looking at nursing home care, what does that need to look like into the future? And so we have innovation plans with a focus on, you know, what are we paying for, and how do we use that funding to require some transformational change and some quality, and how do we incentivize those industries to provide high quality care, specifically to Medicaid members who have complex care needs. So this is our 5, and of course within those 5 really are, I think, probably 25 under each, but at a high level, there's a lot of work happening, and I will just proactively thank you for your partnership as we move this work forward into the next year. And I think I see that we have a question, so I am, just while I'm on, happy to take that question live. I mean, we don't have a ton of time to take a ton of questions, but since there's just one hand, I am gonna go ahead, and Holly, it looks like you have a question. If you can take yourself off mute and ask it. Maybe you read. Go ahead.
Question is from Holly Koopman. And Holly, are you able to ask your question? You should have permission to talk. And if you accidentally clicked raise hand, you can put your hand down if you don't have a question.
No worries. Maybe Holly was just kidding. All right. So with that, I don't see any more brave souls raising their hands. I'm going to keep us moving. Again, a big agenda today, and I'm going to hand it over to Colin, who is up next on our agenda to keep us moving along. Colin, are you ready?
I sure am. Thanks, Bonnie. Can everyone hear me okay? I'll take the silence as a yes.
Colin, we can hear you good.
All right. Good deal. So despite legislative session ending only 50 days ago, it feels like a lot longer. I think session is one of those times where everyone is really working towards the various goals, putting their heads down, and then all of a sudden you come out of that, and it felt like that was 10 years. And then immediately afterwards, with the implementation, everything, it certainly has gone quite fast. So wanted to provide an update on both our legislative items, ours and the other bills that affected the department, in particular OCL, and then update on budget actions, including rate increases, which I know many of you were interested in. So if we could go to the next slide, please, Jen. All right, up first, I'm going to go over the department's budget. Within our R5, we had OCL cost and caseload. We had requested 411 new DD waiver reserve capacity and emergency enrollments. that was approved, plus an additional 129 waiver enrollments on top of that. Those are new enrollments that are not associated with any type of emergent and or reserved capacity, so CES transitions, things of that nature. So excited to be able to work with our case management agencies and our providers to ensure that we can get those new resources filled as quickly as possible. Our R6, which is our provider rate adjustments, good news largely there. We had requested 1% across the board, as well as a lot of focus on our direct care workforce. As Bonnie had mentioned, what we received is sort of a mixed bag, but largely positive. We got across the board increases of 2%. Our single assessment tool was delayed largely because of some delays around the CCM. So we're working very closely with our budget office and folks in the Gov's office and over in the legislature around that. So we'll have some additional information there. But the big news is, again, the 2% from 1%, and then the $1.25 increase to the base wage. So we're actually going from $15.75 to $17 even. We're really excited about that. And then $1 in Denver. So that is up to $18.29 in Denver and $17 statewide. I'll have a slide that sort of summarizes all that here in a minute. Our R9 is
Colin, can I interrupt you real quick?
Sure.
Your sound went really quiet. We can kind of hear you, but
Okay.
maybe use your best teacher voice.
Okay, how is that better if I'm yelling?
That is better.
Okay, I will yell. Our R9 is access to benefits, and that allows us to continue our pain management centers of excellence pilot project after our ARPA funding expires. Our R10 is a new request to really unify what is oftentimes a difficult and an onerous process for members, case managers, providers around various benefits, including private duty nursing, long-term home health, health maintenance activities that will allow for a one-stop shop assessments and sort of coordination on the back end. So case managers aren't having to go between different vendors sort of across the board there, really trying to make that easier for people to understand. But also, I think key is part of that, making sure that people understand what benefits are available to them. So for example, if they don't qualify for private duty nursing, we can then connect them more easily to long-term home health, or perhaps CDOS or IHSS, or any of the additional programs that may be available to them. We go to the next slide. Our R11 is program support. This was unfortunately denied. This was focusing some additional support largely around contractor funding and full-time employees for our systems, in particular our CCM, and some of the additional things that we're doing around the interchange there. That is going to have to wait. So we're working to figure out internally how that will look. Also looking at the person-centered budget algorithm work, working on trying to see how we're going to oversee some of that. That will have to wait as well. And then one of the things that we talk about quite a bit, the direct care workforce, the contractor funding and employee request there was denied. We are working internally to figure out how to continue that work. So more to come there, but certainly something that was disappointing amongst many bright spots was the denial of our R11. The R12 was funding to continue some of our compliance, keeping up with accessibility around our web content that was approved. Our contract true-ups, including additional monies for host home inspection, home modification inspection, that was approved as well. If you could jump to the next slide, please. We had some additional supplemental approvals, including some work that we're hoping, or that we're doing around the public health emergency, really focusing on members within the long-term care system. I know many of you, especially members and those of you who are from the provider community, the advocacy community, have experienced this firsthand, or perhaps experienced this with someone you work with, or someone that you represent. Some focused on the eligibility components for long-term care. That was approved with some technical adjustments. The supplemental or budget amendment 8 really focusing on some of the work that we are implementing around the Department of Justice litigation, trying to support people transitioning from nursing facilities or other institutional settings. That was approved. Very excited to begin some of that work more publicly in earnest. The BA 11, which is ensuring that we can take our ARPA spending plan and align that with what is sort of the next phase in that, trying to ensure that we can get that money spent by next spring. That was also approved. And then the Care and Case Management Stabilization. This was a separate request that we had put forward in order to really stabilize that work. That was approved with some timing and technical adjustments, but very thankful for our friends over at the legislature for understanding the urgency around that and approving that request. With that, we can jump to legislation. And Jen, is my yelling successful in getting the point across?
Doing great.
Great. I hope my wife is not thinking I'm sort of losing it here. All right, legislation. This was one of our bills. It's a high acuity crisis for children and youth. This requires us, the BHA and CDHS, to develop a system of care for individual children who have complex behavioral health needs. It requires us to seek federal authorization to expand the CHIRP waiver to include children who have serious emotional disturbance, and very excited to put that forward. The goal is to get that to CMS by the end of this calendar year. So very quick turnaround. Typically, it would take the better part of a year to make sure we have that. So working very hard to put that forward. We are planning on putting out some information about stakeholder meetings to discuss the regulation behind that change, what ultimately that will look like, so more to come there. And then it requires us to develop and implement a plan to increase access to treatment within the foster care system. So excited about all that work. Know that is really been a collaborative effort. So I appreciate those of you that have taken part in those conversations and that were instrumental in pushing that forward. The Interstate Compact for the Placement of Children, that just adopts the language for how we work with different states on the placement of children. That was also enacted. Medicaid eligibility procedures, that streamlines our eligibility and re-enrollment processes, and it seeks to really reduce and hopefully get rid of procedural terminations that exist within that system. The Medicaid provider suspension for organized fraud, that came about, as many of you may have seen in the news, around our non-emergent medical transportation benefit. There was a fraud ring. It was actually an international fraud ring across various states that was discovered that we had very quickly identified, but it gave us some additional tools to ensure that we can deal with any of those in the future, which we're very thankful for was passed quickly. We could go to the next slide, please. If we could, sorry, the modification of state reporting requirements, this is really sort of a technical bill. This just allowed us to clean up some things that were duplicative or not sort of relevant for the updated versions of either legislation or regulation. Really just for OCL, that meant the removal of one report that we're actually already going to be reporting on more considerably in depth and breadth within the DOJ conversation that's here in Colorado. Out-of-state telehealth providers, this authorizes out-of-state providers to render those services to telehealth for individuals located in Colorado under certain conditions, that certain conditions being the key component. Presumptive eligibility, I'm not going to dive deep into this. It has its own slide. Really excited about this. It is, I know, something that we've talked about and many of you have asked about for many years. So excited to begin that work there in earnest. And then the state income tax credit for care workers, also excited about this from a direct care workforce perspective, allows for certain direct care workers to receive a tax credit. Working with Department of Revenue, our friends over at CDLE and Division of Revenue, we are going to ensure that individuals who are making less than a certain amount are able to get that tax credit and hopefully creating some additional incentives for people to get into that line of work. If we could jump down to the next slide, I'll get into a little bit more around our presumptive eligibility bill. This authorizes us to seek federal authority to implement financial and functional presumptive eligibility for people with disabilities. Put simply, a really easy to understand example of this is someone who may be in a nursing facility, someone who may be in a hospital, and they're waiting for both the assessment and also the financial eligibility to come through. Oftentimes, that delay, would result in someone staying in that setting for longer than is really necessary medically or from a behavioral perspective. And so this allows us to submit a waiver to CMS under an 1115 authority to access a presumptive eligibility lever that would get people into the community or into home and community-based services more quickly. We have an implementation date targeted for January 2026. We're going to be putting out additional information for stakeholder engagement opportunities very soon to iron out sort of any concerns that folks may have. I know we had a lot of conversations with the county in particular, but working with our case management partners as well, trying to ensure that people are on the same page. But overall, this is going to be just an awesome opportunity for people to really quickly get into the community, get those services, ensure that they have the access to the least restrictive environment as quickly as possible. And so really appreciative of many of you. I know we're supportive of this bill, helped lobby legislators, but also helped people understand what we are trying to do. It is sort of complex. And I think one of those things that once you sit down and sort of have those conversations, people understand it. People pretty quickly realize this is just going to be a really powerful tool that we have for people to move into the community and receive those services as quickly as possible. If we could go to the next slide. One of the other items that was not mentioned, but I wanted to add to this conversation was our Medicaid coverage and housing and nutrition services. This gives us the authority to study the feasibility of providing really social determinants of health wraparounds for people on Medicaid. It's intended to help populations, including people coming out of institutions, so out of nursing facilities, out of hospitals, or people who are at risk, so people on HCBS but may have food insecurity that would result in them going to a nursing facility, going to a hospital or other institutional setting. So we're hopeful that what we can do is show that this ultimately will save money. And so we're going to be putting forward an 1115 waiver. There's a lot of stakeholder work around this. If there is an interest, I can find that here shortly after I get done, and certainly paste the opportunities in the chat around how you can access the stakeholder engagement there. If we could go to the next slide, and then I'll take some questions. All right, provider rates. So really just to summarize here, wanted to give this to everyone on one slide. The new rate sheets are up. They were up as of a couple weeks ago. They are available, and I think someone's going to put that link into the chat. But the 2% across the board is for most home and community-based services. It also has the base wage increase. And one of the questions we've been receiving a lot is, does the base wage increase also get, or the services that get the base wage increase, do they also get the 2%? And the answer is yes. Those are iterative. So that means that if there is a base wage increase on that, by and large, it will get the 2%. So that is part of what has been included on the rate sheet. For those providers on the call, there is a breakout of what that looks like, so people will understand sort of what the pass-through is, if you will, not the pass-through, but what the base wage requirement is versus that 2% that is not necessarily tied to the base wage itself. All in all, a really successful legislative season. Really appreciate everyone's commitment to working with us, collaboration on getting a lot of these things passed, and I think understanding of how I think the direct care workforce and the workforce in general is in need of support, and really trying to ensure that we can continue to transform that industry and get the people that we need to take care of those members and services. And so with that, if we could go to the next slide, I will take some questions. All right. Good morning. Does House Bill 24-1229 remove the requirement for a disability determination as well, or just the level of care? Molly, that's a great question. What we'll be working on that really when we get to the stakeholder conversations. Obviously, the disability determination, working through SSDI, there's some questions around how that would interact, but our goal is, again, to ensure that those individuals who may have experienced a life-altering injury that would have a disability, they're able to transition quickly. And so the conversations that we'll have will sort of indicate how that would actually have to operationalize itself for case management. But I think it's a great question and certainly one that we can take back and discuss a bit more. Any other questions? Is anyone on the phone?
If you'd like to ask a verbal question, you can use the raise your hand feature and we can call on you.
Jen, do we have anyone with their hand raised? Sorry, I can't see that. Okay. I'm going to assume that we're good. Well, thank you, everyone. If you do have any questions, we'll put some information on how to get in touch with the Benefits and Services Management Division. Any questions on rates, we can certainly take back. But again, I appreciate everyone's time and appreciate your advocacy and collaboration. And with that, I believe I'm passing it off to Yasmin. Or is this? Okay. Okay, there might be some technical difficulties. I'm just going to run into LTSS stabilization then. If we could go to the next slide. We have put this all, and this has gone out in a variety of emails. I know this has been communicated far and wide, but we have put together an LTSS stabilization website that includes hopefully most answers to your questions. If there is some concern around how you escalate, what some of the things that are out there. So there's sort of the common identified issues that people can address. Anything that folks may have questions around in terms of how they operationalize some of our memos, how they work with the counties, and then how we're ultimately protecting coverage for our long-term service and supports members, knowing that there's some IT issues as well. So please, if we could link that. Thank you, Max, always on top of it. What we would like you to do is, if you do have networks that you could share this with, certainly share that with them. This is meant to be really a one-stop shop for our friends and partners in the community to be able to understand what's going on and what we're doing to try to address some of the situations that have been brought to us. All right, next slide. In addition, we do know that many of you who are sort of out there and working within the CCM or working with our county partners, there is a grievance form. If you discover something that is not working appropriately or properly, if you have any issues with providers that you may be experiencing, any issues with members around eligibility, payment, for example, you can use this and put forward a grievance form to escalate those issues. We do have a good team of people, quite a few people looking through this on a daily basis, really trying to address any new issues that arise, any issues that we're aware of, being able to get that technical assistance out to people as quickly as possible. So again, this is another great opportunity to share this information, share something that we think would be a powerful tool for people to have in their toolbox. And I'm going to check and see, Yasmin, are you ready yet?
Yep, I'm ready. when we're
Awesome.
ready
All right.
for case management redesign.
Perfect. Jen, if we go to the next slide. Thanks, Yaz, and thanks, everyone.
Of course. Good morning, everyone. I'm Yasmin Gardner. I'm the Operations and Administration Division Director here in the Office of Community Living, and wanted to give you a few key updates on case management redesign. We could go to the next slide, Jen. As you are all aware, we completed phase 1 and phase 2 of case management agency transitions. Phase 1 concluded November 1st. We brought on 7 new case management agencies covering 9 of the 20 defined service areas. And then on March 1st, we went live with an additional 5 new CMAs during phase 2. For a total of, and there were a few agencies that served multiple DSAs, so for a total of 7 agencies. We are just 3 short days away from implementation of phase 3 of the case management redesign member transitions. Our final 4 CMAs are currently wrapping up their transition activities. The department will work with our vendors to move members from point A to point B Sunday, June 30th. And then we will have 15 case management agencies serving 20 defined service areas effective July 1, 2024. So that will conclude the CMA contract and member transition portion of case management redesign. Any questions on that piece? All right, I think we can move to the next slide, Jen. Also wanted to talk a bit about the OCL rule revamp for case management redesign. The teams continue to work to clean up on shoring up the rules necessary for case management redesign. In January, the Medical Services Board approved the newly created 8.7 thousand rules, and those went into effect on March 15th. The department continues to have the 8.300 through 600 rules to offer a buffer for the case management agencies and providers to transition effectively into the new case management redesign structure. The team is also working on repealing anything in the 8.300 through 600 series that is duplicated in the 8.7 thousand through 7,500. Excuse me, and presented that at the June 14th Medical Services Board. Coming up next, the teams are working on some minor updates to the sections in 8.700 through 7,500 that will need updating, such as changing language from to the CMA and removing SEP and CCB references, as an example, or ensuring all definitions have been moved to their proper locations in the new rules. The team will continue to post drafts to the website and take stakeholder feedback until that deadline for the Medical Services Board. We also wanted to sincerely thank you all for your help during this process, and wanted to thank you. Your insight has been absolutely invaluable. Any questions on that? Right, thank you everyone for your time. I think I'm kicking it over to Sarah Hurley to talk about access rule.
Yeah, this is Sarah. Can you guys hear and see me? Great. Okay. So I'm Sarah Hurley. Next slide. So just kind of giving you a little bit of background on the CMS access rule. So this was before we said the proposed rule, it's actually final now. Hooray! So the finalized rule, which is really called Ensuring Access to Medicaid Services, it really includes both changes to our current requirements under HCBS and then has some new requirements to improve access to care, quality, health outcomes, and really to promote health equity for Medicaid beneficiaries. So these final requirements are intended to increase the transparency and accountability, standardize data and monitoring, and create opportunities for states to promote active beneficiary engagement in their Medicaid programs. Next slide. So here are kind of some of the changes that are going to be happening for HCBS. So really just an overall, like I said, new strategies for oversight, monitoring, and quality improvement. They're going to strengthen some person-centered planning, and the final rule establishes kind of a standardized annual reporting requirement for states and sets a 90% minimum performance level for person-centered planning processes. And then there's a lot of different things with incident management. CMS has finalized definitions for key critical incidents. They have some changes in there where states need to operate and maintain an electronic incident management system that can identify, report, triage, investigate, resolve, track, and trend critical incidents. And then really they also establish a standardized annual reporting for states. And there's a requirement that 90% again, performance level for when critical incidents are initiated, investigated, resolved, and then when a corrective action has occurred, really when those critical incidents are completed. So then we also establish a grievance system, and this is to allow beneficiaries to file a grievance related to the state's or provider's performance of the person-centered planning process and service plan requirements under the HCBS settings requirement. Requiring 80% of payment for certain services that to be spent on compensation for direct care workers. And so this really is ensuring that a minimum of 80% of Medicaid payments for homemaker, personal care, home health aid, and habilitation needs to be spent on, homemaker, home health, and personal care, not habilitation, be spent on compensation for direct care workers, as opposed to kind of that administrative overhead. Creating an advisory group on Medicaid payments. So I know that we have the MPRAC, but there is a new requirement to include direct care workers, beneficiaries authorized reps, and other interested parties that will advise and consult on payment rates paid to direct care workers for personal care, homemaker, home health, and habilitation. It requires the state to publicly report on waiting lists. And so this will be public, that a description of how the state maintains the waiting list, the number of people on it, and really the average amount of time new waiver enrollees are waiting to enroll. And then finally, there is the public reporting on HCBS quality. And so this is CMS has developed mandatory measures that all states have to report on, so that all states can kind of have this, we can compare how each state is doing with a defined performance measures. Next slide. So just a little bit of background. The Notice for Proposed Rulemaking, or the NPRM, was released last May, so May of 2023. And the department, along with many other associations, submitted comments during this engagement process. And then this final rule was issued in April of 2024. And so these requirements are going to supersede or fully replace current reporting requirements. And it applies to 1915 Cs, Is, Js, and Ks, those programs. Next slide. And then here's a timeline of when everything needs to be implemented by. So the Medicaid Advisory Beneficiary Committee, so the one where I was just talking about, where people are going to be looking at rates and consulting on that, is next July 2025. And then in 26, We have our quality measure set and the grievance in fee-for-service systems. In July of 2027, that's a big year. We have the incident management system, critical incident reporting, person-centered planning reporting, waiver waiting lists, timelines, website transparency. In July of 2028, we have the HCBS payment adequacy reporting. In 29, the electronic incident management system needs to be in place. And then finally in 2030, that's when the payment, the minimum performance level of the 80% needs to be implemented by. And if anyone wants some light reading, I'll actually just put this into the chat. This is the finalized regulation, so you can go and check that out whenever. And I think that's it for me. Thank you.
Good morning, everyone. This is Haley Gleason. I'm the Strategic Outcomes Division Director within the Office of Community Living, and I am thrilled to be here to provide an update on the American Rescue Plan Act home and community-based services. You've heard this mentioned by both Bonnie and Colin, but I'm going to go into a little more detail about where we are in our progress. Next slide, please. So you've probably seen this slide before. We've been updating it along the way to demonstrate how we're moving things along. So as a reminder, we have 61 total initiatives underway across our ARPA programs. They total $550 million of reinvestment into our home and community-based services system. And 90% of that is directly benefiting the community, which we are so excited about. We have completed 11 projects to date, which is exciting. And we have more projects that are completing every single month. So those are really moving along and getting into the closeout phase. We have over 1,500 grant recipients. So grant programs have been one of the primary ways that we've been able to distribute funds out to individuals, providers, nonprofits, community-based organizations, and are really so excited to start to see the success of those grant programs. And we'll keep hearing about those as we begin to move to closeout of our grant. We have 9 months left to spend all of our ARPA funds. So we officially close the entire program March 31st, 2025. We have continued to see great engagement by our stakeholders. You can see that we've had over 10,700 attendees across all of our stakeholder engagement. So that's our ARPA webinars, but also the individual project engagement. So there have been meetings, there have been surveys, there have been webinars, all sorts of things. And we really appreciate all of your participation, as that's really been so critical to the success of these projects. And then finally, our webpage continues to be a real hub for information around the progress of these projects. So, we're almost to 100,000 page views. I have no doubt we will hit that by the end of ARPA. So, lots of traffic coming and going from our webpage. And we are, continuing to encourage people to utilize that webpage, because that is where we're posting updated information about opportunities to engage, as well as when projects close out, you'll see that we provide information about the outcomes of that project and any type of deliverable that came in, maybe a report or an additional web page that's particularly focused on that project. That will all be on that ARPA webpage. So encourage you to take a look at that if you haven't visited it recently. Next slide, please. So since we are beginning to move towards closeout, we are really interested in beginning to demonstrate and share the impact of all of this work that's been underway for the last 3 years. So as I'm sure you know, many of our projects have training programs as part of their scope. So in total, 10 ARPA HCBS initiatives include some type of training program. So either funding training, developing new training, whatever that may look like, but some type of training is being funded by ARPA HCBS. In the aggregate, across those 10 different projects, thus far, we have trained 750 individuals, which is really exciting to see that so many people are benefiting from these training programs. We've also funded the creation of 23 new training programs using ARPA funds. And this just shows just one little snippet from the surveys that we are utilizing for those participants who take the trainings. And this shows that, you know, a large majority, almost 85%, have scored feedback on that survey saying that they strongly agree that they will incorporate the skills into their daily work. So we've really tried to, where we can, you know, grab those evaluations and incorporate those surveys so that we have the outcome-based data to be able to demonstrate whether these programs are successful. So that's just one example of a survey result from those training programs. Next slide, please. So as I mentioned earlier, the grant programs have been a primary way that we have been able to disseminate funding out to the community. And we're so proud of these grant programs and the work that our grantees have been able to accomplish over the last couple of years. I see that this number is actually, it's amazing that just by like 2 months, this number is outdated. We are up to over 1,500 grant agreements, so even higher than 1,300. We continue to grow. And those grant agreements are with individuals, providers, nonprofits that really, you know, span the different type of grantees depending on the program itself. And we have 26 different grant initiatives. So they're really focused on very different things, priority areas around home and community-based services, the direct care workforce, and behavioral health. We have seen thus far about $77 million in spending across these grant programs. So, you know, really great to see that those grant programs are, and that funding is getting out to the community partners. We have over 100 million that's dedicated, so still more funding and spending to happen. And then at the bottom here, you can see that it says agreements with over 400 grantees with a diversity classification. So this classification would only apply to organizations or businesses. It's why the number is smaller than that 1,300 number. But the graph on the side shows that that's almost 90% of the grantees, whether, you know, organizations or providers, employers, categorize themselves as a diversity business. And diversity means they could be a small business, minority owned, women owned, veteran owned, or a business that employs people with disabilities. So we are incredibly proud that over 90% or nearly 90% of these funds have gone to businesses that identify in that classification. Next slide, please. So since we are moving towards the end of ARPA, we wanted to cover some key dates just so you know what's to come in the next 9 months or so. So the first key date is September 30th, 2024. So that is really coming up soon. At that point, project activities for ARPA really need to end. So that is our end date for any external, particularly, you know, vendor work, grantee work, external organizations that are receiving ARPA HCBS funding. The work has to end by that date. By November 31st, we have the internal goal of trying to get all of those invoices paid out. As you can imagine, across 61 different projects and all of those grantees, we have a lot of invoices that we need to process and close out. So we want to try to get those going and get everybody paid in a timely manner. So November 31st is our goal for getting people paid and closing out those invoices. And then by December 31st, all ARPA projects need to be closed. So we have a really robust closeout process to make sure that we have all of our documentation in place. We have, put all of the information up on the website. We have demonstrated and documented our outcomes from the projects. All of that needs to be done by December 31st so that we can see that all of those projects are successfully closed. And then by March 31st, 2025, that is the official end date for ARPA HCBS per the Centers for Medicare and Medicaid Services. So that is the drop dead end date. And so between January 1st and the end of March, we will be doing all of the back of the house administrative work to close the books on ARPA and make sure that every single dollar has been spent and that we can officially close out ARPA HCBS successfully. And don't worry, we will have plenty of closeout end of ARPA reporting and presentations so that we can inform our stakeholders on how everything ended. Again, please visit that ARPA website because that is going to be the primary location that we continue to keep stakeholders updated on our progress. Next slide, please. So we do, even though we've only got a couple months left, we do have a couple of final grant opportunities that are still available. They are getting close to closing, so we wanted to make sure that you were aware of them in the event that you want to, get in those applications. Next slide. The first one is for Project 1.05. You have likely heard us talking about this. This is directly to benefit our direct care workforce. So we are offering grant funding to individuals to pursue additional training to expand their skills. So, you can see here that the workforces that are eligible would be those that provide direct care in Colorado's HCBS waiver programs, certified nurse aides, home health aides within long-term home health. So if you happen to be a provider organization and know of some of your workers who might be interested in pursuing some additional training or skill development, this is such a great opportunity. We've really worked over the last couple of months to simplify this process to make this very easy for people to apply and be able to get access to these funds. So deadline is looming. July 15th is the last day to apply. So please continue to spread the word about this. And next up, I'm actually going to hand this over to Max Winkler. And he is going to share some information about the Member Emergency Preparedness Grant Program.
Great, thank you, Haley. Good to see everybody. I'm excited to provide an update about this grant program that myself and Cassandra Keller are managing within OCL. This is a really exciting program that's available to members who have a need for a backup battery power system due to using life-sustaining devices. So a backup battery power system, what is that? These are essentially very high-tech generators that use batteries to power themselves. They can be charged by a traditional outlet in the wall. They can be charged via solar or actually through a vehicle. And they're critical for individuals who might have a need for a life-sustaining device in the incidence of a power outage. So power outages can happen for all sorts of reasons. It could be just that the grid goes down. It could be a wildfire. It could be high winds, like in the southeastern portion of our state. So these are really critical devices that any member that needs them should have on hand. And we're excited to report that we've distributed over 1,000 of these devices throughout the state so far, covering a wide swath of our rural areas. And we still have more left. So we're doing our best to get as many as possible distributed before those funding deadlines that Haley just outlined. So how do you qualify for one? Let's go to the next slide. In order to be eligible for one of these really cool devices, you just have to be an active member and you need to utilize a life-sustaining device. that requires electricity. So that could include things like chairlifts, CPAP machines, nebulizers, power wheelchairs and scooters, even things like refrigerators to keep refrigerated medication on hand. So definitely let your friends, your family members, your clients know about this opportunity. We will be continuing to distribute these as late into the process as we possibly can. I think we've probably got another couple of months at the most to get these out. So time is running out. I'm going to post the link into the chat where the application can be found. And if you have any questions, we are partnering with the Center for Inclusive Design and Engineering at the University of Colorado, and Julia Beams. Her contact information on this slide is here if you have questions about the program. So I will pause for some questions. And I think, Colin, you wanted to respond to some of the Q&A, I believe. So we can go to the next slide.
Yeah, that would be great. Thanks, Max, and thanks for your patience in the Q&A. Caught that a little bit late. First, if I could address Lauren. Lauren, you had mentioned our 2023 comment to CMS, our official letter, wherein we did outline some of the concerns we had with the 80-20 requirements, knowing that we have actually done a pass-through in Colorado and did find that administratively burdensome for both our direct care workers, but also our providers and frankly our members, just trying to get them to understand what their obligation was, in particular within our participant-directed programs. That's a great question. So I will say it is 2030, and while that seems very far off, and you know it is also sort of the blink of an eye when it comes to programmatically and how you know we need to respond and prepare ourselves and our provider community and our members. And so we are working really closely with CMS. In fact, some of us attended a national conversation just a couple weeks ago with CMS present and outlined some of the concerns we had. I think what we're trying to do is understand what does Colorado do well now? What do we do that has created some efficiencies in that process? And how can we keep those efficiencies? How can we keep some of the simplification that we've created with reporting, but also ensure that we're meeting the new federal requirements? So I know that's sort of a non-answer in many ways, but we are working with CMS, and I think what we're trying to understand is what flexibilities do we have. And so we will be putting together various stakeholder groups around many of the different components of the access rule. I mean, there are over 10 components specifically when you sort of break it out piece by piece. So those conversations will begin. I will say CMS has indicated to us we will not have technical guidance or technical assistance available for that component of the rule for likely another year. So I know many of us are anxious around that in particular. That tends to be sort of the leading conversational piece, certainly. And so when we get that technical assistance, when we get that guidance, when we're able to have those conversations with CMS, we will certainly pull people in, but it is going to be a little bit. So I just caution people to get too far ahead of themselves. Certainly don't want people to go out and you know, invest money in sort of new EHRs or new systems until we're able to get some additional conversations with CMS and have those conversations with you all. So more to come, unfortunately. With that, the other question was around the grievance form that we have, not necessarily the grievance process within the access rule that Sarah talked about. If I'm understanding Christina right, she had said they'd submitted some tickets and they haven't received any help or follow-up. What is the next step? Oftentimes you won't receive direct follow-up. There's not an update that happens in real time saying, hey, we received this and you know, here's what we're doing. They tend to just kind of work those. We do those as they come in. Some of them are very complicated and we are receiving quite a few. So it is not something that unfortunately for those more complicated cases can be done in a quick manner. But if you are wondering a status update or believe you haven't had any movement whatsoever, Max will put an email in the chat. Please send the actual case number. When you submitted that, you should have received a reference number. Please send that reference number so we can look up that specific escalation and sort of see where it's at. I would caution people though, if you are waiting on something, again, those are worked on in the order that they're received, and there are quite a few. So what I don't want folks to do is sort of rush to sort of say like, where's this at? Because that will take away from people's ability to work those cases. So I would only exercise that option if there's A, an emergency, or B, it has been sort of an unreasonable amount of time. But we certainly understand the concern and empathize with the delays. And please know we are doing as much as we can. There's additional staff that are being reallocated to that work as well. So hold tight, and I'm hopeful we can get back to you very shortly, Christina. And with that, I'm going to kick it back to Max, who I know has some additional information about stakeholder engagement opportunities and some housekeeping items to discuss.
Great, thank you, Colin. So I'm going to close us out with some updates related to the broader stakeholder engagement efforts that we have here within the Office of Community Living. So Jen, if you can go to the next slide. So just to kind of remind everybody what our goals are for stakeholder engagement within OCL. We constantly are striving to respect our stakeholders' time and to be as efficient as possible. We know that everybody has tremendously busy schedules. In some cases, it's not your job to be a stakeholder. And we want to make sure that we are engaging as broadly as possible with as many different stakeholders that we interact with, whether that be a member, a family member, a friend even, a legislator, a provider. We have a large audience that we want to reach, and we want to focus on collaboration. And finally, we want to set some clear expectations that ties directly into our desire to respect everybody's time, knowing that we all have very busy schedules. So as a result, we've been doing some work internally, figuring out ways that we can continue to make small adjustments that get us closer to these overarching goals. And one of those adjustments that we are excited to announce today is a slightly restructured format to our weekly newsletters that OCL sends out. Some people call them the John Barry newsletters. John's been sending these out for years. So we are excited to continue to evolve and improve and really adapt the way that we communicate and share information out to our stakeholders. So we can go to the next slide. This is a preview of what that newsletter is going to look like. The first one is going to go out today. So previously, we've structured these into sections around announcements, memos, and meetings. We wanted to adjust this because we wanted to provide some more context to especially things like meetings in terms of what the interaction expectation is with our stakeholders. Some of these meetings, like this webinar, for example, are purely informational updates. They're by and large one-directional. We're sharing announcements or updates about information that we are working on, and we're not seeking feedback, and there's no action required of our stakeholders. The other side of that coin is the engagement opportunities that have opportunities for input. So we're looking for your feedback. We're looking for survey responses. We're looking for stakeholders to actually do something related to the work that we are doing internally. And this could also be a meeting, maybe a different type of meeting. It could be a collaborative or a work group or a survey request. And we want to be able to flag those in our communications so that if you have a very busy schedule, you're not showing up to an informational meeting expecting to provide feedback and you aren't given the opportunity to do that. So we're going to divide the information that we share out into these two major buckets. And then we're also going to create a special section that shows specific opportunities for training and technical assistance that we might be providing specific to various topics. And then finally, we're going to publish all of our events that are upcoming instead of just the next week or two of events in a more simplified list. So at least 3 weeks out so that people can plan a little bit more ahead as it relates to their time and maybe do a little bit of their own calendaring, getting things on their radar sooner than we might have been allowing them to in our current structure. So we're excited to launch this. We are very much looking for your feedback related to this. So please send us your emails with your thoughts on this, or if you have suggestions for other things that we could modify. Again, we're looking to really, work together and make this as smooth and efficient for everybody involved. So I actually have a poll question that I'll launch on the next slide because we are curious to get your input about the different modalities. So we've got several different ways that we do engagement, and we are curious to know from our stakeholders which is their preferred method. Is it weekly newsletters? Is it webinars like this? Is it just navigating the website on your own time? or is it attending other more specific topic-based OCL meetings? So I'll leave this survey up for a moment so that we can get some feedback, and we'll be asking things like this in the newsletter as well, so we capture as many people's opinions that we can. Great. It looks like we're getting good responses. By and large, the weekly newsletters are the preferred method, so they will not be stopping, just so you know. We do find them to be extremely effective as well. So please do share your feedback on the new structure. And again, if you have suggestions for other changes, we are all ears. So I will advance us to the next slide. All right, and I'm going to close this out now just with some reminders. We've got our calendar on our website, our memo series. That slide needs to be updated, and that's something I will do right after this meeting to be 2024. We've got our email, we've got the ARPA page, the newsletter that we just talked about, and of course the webinar page, which is where all of our materials, slide decks, recordings will be posted for these webinars. Next slide. We do have other ongoing opportunities. This is on the stakeholder engagement page where our calendar lives as well. So these link directly to committees and work groups or other kind of hot topics, if you will, related to the work that we're doing within OCL. So another great page to bookmark if you don't have it already. Next slide. And survey. So we're constantly looking to get your feedback on how these engagements are going, specifically these webinars and meetings that we have. This is a survey that many of you have probably taken, but we are always evaluating to see if things are changing and if we need to make any adjustments. It takes about 60 seconds to complete. So if you do have the time, we would love to hear your thoughts. And then finally, a little preview for our next webinar that we'll be doing for the ARPA quarterly update, August 17th at 3 p.m. These webinars are going to become really helpful, I think, understanding the work that's been done over the past several years related to ARPA. As we close out a lot of these projects, we have some really exciting updates to share, whether it be success stories or the data that's coming out of the work that we've been doing. So please join us on the 17th if you'd like to hear some updates about these projects. And with that, I will say thank you and close us out, and we look forward to seeing you all soon. Thanks, everybody.